I just had happened to me. The exact reason why, like, I don't go to the doctor anymore. I haven't been to a dentist in 5 years because I lost insurance. You know, I'm 29 now. I eventually lost insurance, and also other stuff happened. And stuff that just kind of pushed it off.
Guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me. And
The US healthcare system is insane. For the one visit, $34,000. $28,000 is not covered.
I just need to complain for 1 second about our godforsaken healthcare system.
Hot take, but can we talk about how the Chinese healthcare system is better than America's? Like, have you seen the bills that Americans get after a hospital visit? That's bankruptcy in a PDF. Like in China, you can literally walk in, get treated, and not need to sell a kidney to pay for it.
So I just got my hospital bill in the mail, and before I had a baby, I always wondered how much it costs to have a baby here in the US. I have pretty good health insurance, but this is the breakdown of my hospital bill for a whopping total of $51,383. This is before insurance.
Imagine walking into a hospital, getting treatment for a serious injury, and leaving the same day with no crushing bill, no insurance battle, and no endless stress about how you'll afford it. Now imagine that same scenario, but in America. You get patched up, and then weeks later, you receive a $20,000 bill for services you didn't even know you were charged for. Suddenly, your future plans, your savings, even your home, are at risk. For many Americans, this isn't just a nightmare. It's their reality. And now, more and more Americans are looking at countries like China and asking a simple question. Why can they afford to take care of their people while we're drowning in medical debt?
You know, I hear a lot of people on the right in the United States make the argument that a socialized healthcare system would be bad because we would be waiting months and months and months to see a doctor. I hate to break it to you all, but that's already true. Even if you have the best insurance, you could still be waiting months to see someone, unless you're lucky and an earlier appointment opens up. When I had a primary care doctor, she was booked out for months. It was virtually impossible to get an appointment with her. And not only are you waiting months and months and months in the United States to get the care that you need, or even just for routine stuff, you are most likely going to be paying a lot of money for it out of pocket. I don't know about you, but I will take the months and months and months of waiting, but have it be free or very affordable versus having to wait months and months and months and still paying a lot of money for care. It's also not true that you're waiting months and months and months for care in other countries. I'm not doubting that it happens, but it's not anywhere near as widespread as the people on the right here claim it is.
Hi guys, you can complain everything about China, but you have zero word to say about their healthcare speed. Today my eyes are feeling a bit itchy, painful, unsexy. So let's go visit China's public hospital. Since we're doing eye check, of course I need to remove my makeup. I just reached the hospital. 7:50 a.m. registration, which costs around 15 RMB. 8 a.m. queuing in the line. There are already some people there. 8:10 a.m. my turn. The ophthalmologist asked me some basic questions. 8:15 a.m. pay for all the checkup fees, which cost around 270 RMB. 8:20 a.m. go back to the eye doctor to do the checkup one by one. 8:35 a.m. doctor analyzing the result.
I got a very serious 干眼症.
8:55 a.m. pay for all the medication fees, which cost around 230 RMB. 9 a.m. collect all my medications.
It's not even 1 hour. Now waiting to do my treatment.
9:10 a.m. doing 2 types of treatment for my 干眼症.
Now it's only 10 a.m. 2 hours only. I finished everything. My eyes have never been felt so clear and bright before. It's super efficient, guys. It feels like someone is chasing the doctors and nurses to be faster and faster. And actually, at some point of time, I feel a little bit stressed of doing something wrong to stop them from being efficient. 10 out of 10 experience.
America has some of the most expensive healthcare in the world, yet it consistently ranks far lower than other developed nations when it comes to health outcomes. For most Americans, healthcare is a gamble. Even if you have insurance, you never really know what you'll end up paying. Ambulance rides can cost thousands. A simple ER visit can bankrupt someone overnight. And worst of all, medical debt is now the #1 cause of personal bankruptcy in the US. It's no surprise that Americans are furious when they see how healthcare works in China. While Americans are drowning in endless bills, Chinese citizens are paying a fraction of the cost for the same or better services.
That boy said he went to China, got an MRI, X-ray, and blood work for $80. $80 for an MRI, blood work, and X-ray. You know how much that shit would have cost in the United States? Do you know how much that shit would have cost in the United States? Well over 15 grand. Well over 15. It can cost up to $12,000 for MRI alone in the United States. X-rays, on a good day, $100. Blood work, a few hundred. The medicine that I'm on, the medication that I'm on, over there, I could get like 10 months worth for $170. $170. You know how much it costs in the United States? $1,100. If you never felt like the United States was duping you, you should now. Because they are very heavily taking advantage of the American citizens.
The US healthcare system is insane. I just want to start this off by saying that I have really good insurance under my parents' names. And I had to go to the ER in November for a cluster headache that was on day 2 that would not cease after migraine medication, everything that I could take and think of. So I had to go to the ER to make the pain stop because I literally couldn't do anything without shooting pain. Anyways, for the one visit, $34,000. $28,000 is not covered. My mom goes, well, when you go to the ER, did you check that they were in network? And I said, it's the same building where I go to my other doctors. I figured it would be in network. She goes, no, Lindsay, sometimes if the ER doctors are not in network, you have to check for the individual doctors. I'm like, Mom, it's the ER. You think I don't check that before I go? I just...
Many Americans who travel to China for work, study, or even tourism are stunned when they experience the Chinese healthcare system for the first time. One story that went viral on social media was from a young American teacher living in Beijing. She shared how she went to the hospital for a broken arm, expecting a nightmare like back home. Instead, she was treated immediately, got an X-ray, received a cast, and walked out after paying $25 total. She said it felt surreal, like living in an alternate reality. Other expats shared similar experiences. A routine doctor visit costing $3 or $4, paid out of pocket. Medication price so low that they don't even bother using insurance. No surprise bills, no months-long wait for approval, no harassment from collections agencies. For Americans, it's both eye-opening and heartbreaking.
I just need to complain for 1 second about our godforsaken healthcare system. Okay, so about 3 weeks ago, almost 3 weeks ago, maybe a little more than 3 weeks ago, I overextended my right ankle, like the back, like the Achilles tendon area. My amazing kitty tripped me when I was going up the stairs to the basement or from the basement, and hello, there he is. Thank you, that amazing kitty. I overextended my ankle while I was trying to regain my balance. Since then, it has been increasingly painful, but I don't go to the doctor for myself because, for one, I don't have the time with the kids and work and everything else. It's hard for me to take time out of my day to do those things. But for two, even if I wanted to go to the doctor, I can't afford to. So I am making, in my professional career right now, I am making more than I ever have previously in the other jobs, which makes sense because I've been at this place for almost 9 years, and I have a role in management, and my salary it's decent, but I'm still, with having kids and a mortgage and the bills and all of that, I'm still very highly debating getting like a weekend job to help pay my bills. So I'm not rolling in dough by any means. But I do have health insurance through my place of employment. So I pay my insurance every paycheck. I have a pretty high deductible, so there's that. But when I had COVID back in January and I went to urgent care to get swabbed, after insurance, I paid over $500 out of my pocket for that COVID test. And I get it. I work in healthcare, animal healthcare, but healthcare nonetheless. So I get that there's a fee. You go to the clinic and the technician does the swab, and then you have to pay for the doctor's time, and then you have to pay for the lab charges, and the clinic then has to pay the lab for them to run the tests, and they have to recoup those costs. I get how all of that works, but I can't afford, as a 38-year-old woman, I can't afford to go to the doctor to have my ankle looked at because they're going to want to take an x-ray. They're going to want to do all of the things. And I simply just can't afford it. I can't afford to have it looked at. And don't come at me. I know you're going to come in the comments and say the more I walk on it and the more I do all the activities on it, I'm just going to make it worse. I know all of that. And I'm not going to be able to afford to get it fixed at that point either. This is more for me to vent and kind of bitch and moan at the godforsaken state that our shitty country is in when it comes to, their citizens and healthcare and all of the things. It should not cost me $500 out of pocket for a COVID test when I have insurance. I don't get it. I don't get it. And I need it looked at. It hurts. I'm still doing the things. I went to my first workout class yesterday, and I was I kind of took it easy on that side. And so I'm not letting it ruin my life, but it is increasingly painful. And I know that there's something wrong with it. And it just sucks because I can't physically afford to go to the doctor. How are other people making this happen? How do you prioritize your own healthcare? What are you doing? What are you doing to afford to go to the doctor? Because I need those tips and tricks. It's getting bad. It's getting bad. It makes a crunchy noise when it's bad. So help me. What do you do? How are you affording to live right now?
Today, I just saw a clip, Chinese just invite Americans to buy a ticket to fly to China to do that medical care. What you going to cost is only your flight ticket. The most part of it is your flight ticket. It's almost maybe $1,000. From my own experience, my dad had a heart attack 3 years ago, and basically he's living in Europe with my sister, and I take him to the Beijing, the most famous cardio hospital in the Beijing, and do that big surgery. That surgery is you're gonna to cut out your chest and put another kind of wing, do some kind of remedy on his big wing between his heart. I don't know, some kind of really fancy surgery. In total, it only, the surgery take 6 to 8 hours. And after that, my dad is leaving the ICU for 3 days and CCU for 2 days. And then right now he's traveling the whole world by his car. And he even tried to find a girlfriend. Right now he's swimming. You know how much he cost in whole surgery? That's amazing. Trust me. It's only $10K. It's only $10K. That big surgery. Oh my God. And it is done by the most famous cardio, the surgery doctor in China. And we don't do any extra money. And it's done. And I live in Beijing to take care of them.
The obvious question is, why can China afford to provide care this way while America can't? It comes down to system design and priorities. China views healthcare as a public good, something that benefits society as a whole. The government has invested heavily in building hospitals, training doctors, and creating an efficient network that serves both urban and rural areas. Most importantly, China controls costs at every level, from medicine prices to hospital fees, to ensure that care remains accessible. Meanwhile, in the US, healthcare is treated as a for-profit industry. Every step of the process, hospitals, insurance companies, pharmaceutical companies, is focused on maximizing revenue, not minimizing costs. The result? In China, a family doctor visit costs less than a cup of coffee. In America, the same visit can cost hundreds, even before insurance.
Hot take, but can we talk about how the Chinese healthcare system is better than America's? Like, have you seen the bills that Americans get after a hospital visit? That's bankruptcy in a PDF. Like in China, you can literally walk in, get treated, and not need to sell a kidney to pay for it. Like imagine that, affordable and efficient, and you don't need to call your insurance company 15 times just to understand what is covered. Meanwhile, in America, we're paying $500 for a Band-Aid and need to wait 6 months to see a specialist. Like, what is this? A luxurious spa or a healthcare system? So yeah, while America has the best healthcare, only if you're wealthy. But for the rest of us, yeah, China's winning. Bye.
I just watched a video of an American person in tears because they found out that Chinese people have public toilets. Oh great, now I can't open my eyes. And they're also really surprised about how am I meant to do this? And they're also really surprised to learn that Chinese people don't pay for ambulances either. I saw a video a minute ago of a woman being like, when they get an ambulance, it's free! On Rednote, people in China think that it's propaganda that people actually have to pay for ambulances. And Americans are shocked about it. Firstly, I'm confused because everyone's been saying this to Americans. Like, we don't pay for healthcare either. But anyway, it makes you wonder, what the hell have they been learning about China? Like, I don't know that much about China at all. But, like, I would never have thought that China doesn't have public toilets. Like, they're pretty high tech as far as I'm aware. I've been seeing videos about how they got, like, touchscreen things in their toilets. And, I'm not surprised about that. But there's a video of an American woman in tears to learn that. Like, what have they been learning over there about China?
This might sound strange, but public bathrooms tell a powerful story about how a society treats its people. In China, clean, free, and safe public toilets are everywhere. In subways, parks, shopping areas, even remote towns. It's a reflection of a government focused on public well-being and dignity. Compare that to the US, where finding a public restroom can be an ordeal. Many Americans end up paying to use bathrooms in stores or restaurants, and even then, the conditions are often poor. This isn't just about convenience, it's about respect and infrastructure. If a country can't provide something as basic as clean public bathrooms, it's no wonder its healthcare system is falling apart.
So you were telling me that people are unaware, they're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
I just had happen to me the exact reason why, I don't go to the doctor anymore. I haven't been to a dentist in 5 years because I lost insurance. I'm 29 now. I eventually lost insurance, and also other stuff happened. It's stuff that just kind of pushed it off. COVID. I finally have insurance. So I was like, yeah, I gotta go to the dentist. And I work at a university where there's a dentist office on campus. And I was made to believe that they were in network. And then today I get a bill for $600, which is a whole paycheck for me. And I'm like, what the fuck? And I was like, hey, I'm just like, I thought I already paid this. And she's like, oh yeah, it turns out we're not in network for you. It's like, why didn't you tell me before? Why didn't you tell me before? I wouldn't have gotten to you. You wanted my information.
The real tragedy is that this isn't just about healthcare, it's about quality of life. When Americans see how affordable and accessible care is in China, it forces them to confront a painful reality. The US system isn't broken by accident. It was built this way. Every year, millions of Americans go into debt just to stay alive. Families are forced to choose between paying for treatment or keeping their homes. And while this is happening, the corporations profiting from illness are posting record-breaking earnings. The contrast with China shows what's possible when a government decides to prioritize its people over profits. This is why Americans are so furious. It's not just jealousy, it's grief. It's anger at realizing they've been robbed of something they should have had all along: the right to affordable, dignified healthcare.
People keep talking about how China is getting old, but they're missing something very important. China is aging because people are living long, which is a good thing, I think, because not long ago, China had a dying problem. In 1949, the year of the founding of the People's Republic of China, life expectancy was under 40. That is way too low, but now it's 79. And so within just a few decades, China managed to double its life expectancy. And China did that by turning economic gains into better quality of life and living standards, including investment in healthcare. And so between 1990 and 2021, national healthcare expenditure in China went up by nearly 100 times to $1 trillion US. And a lot of that money went into improving healthcare accessibility, healthcare capacity, and building medical infrastructure, hospitals in big city, community health centers in towns, and village clinics. And that last point is very important because China has a long history of focusing on rural health. Back in the 60s and 70s, when the life expectancy was low, China introduced the concept of barefoot doctors. Basically, these were farmers or high school graduates who underwent basic medical training to serve the communities where they lived in the countryside. They would go door to door, they would give vaccines, deliver babies, or just offer primary health care. And so today, 90% of Chinese households are within 15 minutes from the nearest healthcare institution. But probably the best achievement China has made is its near universal health coverage. 95% of people in China have basic medical insurance, which drastically lowers their financial burden. In 2023, patients paid 27% out of pocket, and the rest was covered by the government. Healthcare in China is affordable, it is accessible. You don't have to wait days, weeks, or months to see a doctor, and more importantly, prices of medical services and drugs are capped by the government to stop exploitation because, believe it or not, health is a right and not a luxury.
So I just got my hospital bill in the mail, And before I had a baby, I always wondered how much it costs to have a baby here in the US. I have pretty good health insurance, but this is the breakdown of my hospital bill. So the first thing was the room where I stayed at after delivery, and that was $17,760. Pharmacy, $55. Medical surgical supplies, $1,323. Non-sterile supplies, $2,437. Sterile supply, $50. Lab work, $1,484. Immunology, $450. Hematology, $1,098. Anesthesia, $615 for that nice epidural. Drugs required, $59. Delivery room, $20,395 for a whopping total. Oh wait, no, I missed it. I don't even know what the heck this is. $5,657, and then for a whopping total of $51,383. This is before insurance, and just as an FYI, there was no complications at all during my birth, natural delivery, no issues whatsoever.
The comparison between the US and China isn't about who's better. It's about what's possible. If China can provide clean, efficient, and affordable care for over 1 billion people, why can't America do the same for its 330 million? The truth is, Americans don't just need to be angry. They need to demand change. Because every year that passes without reform is another year where millions suffer unnecessarily. The next time someone says America has the best healthcare in the world, ask them, best for who? The people or the corporations? The answer to that question will determine America's future.